Hello everyone, I am Valeria Franco and today I have a very special guest, Dr. Nirit Soffer Dudek. Welcome.
Hi, thank you.
So you are Ellie Sommer's research partner and also you are the head of the Consciousness and Psychopathology Laboratory upon the University of Negev. So how long have you been studying maladaptive daydreaming and from which point of view?
Well, it all started when in 2015 I published a paper on dissociative absorption, which perhaps I can tell you a little more about shortly, and its
Yes.
relationship to OCD, to obsessive compulsive disorder. And dissociative absorption basically is really a tendency to become very much involved with total attention on one stimulus and forgetting about everything else. So your attention really, you neglect all the surroundings. You don't notice anything other than the thing you're focused on, which could be daydreaming. And a lot of times it is daydreaming. And it's very, very much related to maladaptive daydreaming, which I didn't know the term then, but I was very interested in dissociative absorption. And most people study dissociation in relation to trauma. And my interests were studying common dissociation, mild dissociation, or moderate dissociation, not severe dissociation, and study it in relation to other things, not just trauma. And in the past years, I've been studying very intensively the relationships with OCD. So Professor Eli Zomer saw this paper, and he felt immediately that we have much in common because it was exactly at that time that he started renewing his interest in maladaptive daydreaming after not researching it for over 10 years. And the papers with the questionnaire and the papers that started this wave of research, they were still not yet published, but they were on their way to be published. So he contacted me and he said, look, read these, and look, we have a common interest. And to persuade me, he sent me a few emails of maladaptive daydreamers who were writing him following his 2002 article, and they sold me. I read them, and immediately I said, wow, this is fascinating. I must understand this better. And ever since, I've been helping him to promote the research on this interesting phenomenon, and eventually to help the sufferers. And my background is, I started out as a dream researcher, nocturnal dreaming. And from there, I went on to study dissociation, altered consciousness in waking. And now I'm also a daydreaming researcher, thanks to Ellie.
That's very fascinating. And yes, as you noticed, the online communities are very active about maladaptive daydreaming. And I have asked the communities to ask questions for you. So I have gathered a few.
Right.
And yes, they asked me, is maladaptive daydreaming a compulsion? So how does it relate with OCD?
Okay. Well, that's really an interesting question. And in our studies, we found that there's a strong relationship between maladaptive daydreaming and OCD, but it's not a relationship of comorbidity. It's not just that people are also diagnosed with OCD. It seems to be more of really shared mechanisms. So in one of our papers, a paper that I published together with Ellie, we found that we studied this topic day after day in a daily study. And we found that OCD was the only distress variable that increased on the days prior to an increase in maladaptive daydreaming. So there was some kind of an increase in obsessions and compulsions that predated the increase in maladaptive daydreaming. So that really points to maybe some kind of a shared mechanism or something that may be causal, in like a causal chain causing each other, which was really interesting for us. And it was the only variable out of several, depression, anxiety, and a few other variables, it was the only one that increased on the day before. And there was an increase in maladaptive daydreaming. So that's one aspect of an empirical relationship between the mechanisms. But on a more deep level, maybe understanding what it is. Is it an obsession? Is it a compulsion? So we still really don't know. I mean, there are aspects of maladaptive daydreaming that really resemble obsessions, because some people experience it as very intrusive, and they feel like they have little control over it or impaired control. So some people feel like it's really intruding into their minds, and they just try to do something else, and all of a sudden they see these things and just enters their mind. But I must say, not all of the maladaptive daydreamers say that this is their experience. Some people experience it more controlled. They feel an urge and they say, okay, I have to now leave what I'm doing, I'll go do this, and then I'll come back, and they have more control over it. So it's a question, but that is kind of similar to obsession in the intrusiveness. But on the other hand, it's like a compulsion, right? Because it's something behavioral that you do. It's a mental behavioral compulsion. So we asked this question: is it more like an obsession or more like a compulsion? In another study, which is not yet published and is now under review to be published, and we found that it has stronger relationships with obsessions. So there is a relationship with compulsions, with compulsions that are common in OCD, but the stronger relationship was with obsessions and with this ruminative aspect of not being able to somehow stop the stimuli from entering my mind. That was the strongest relationship.
Okay, and my next question was about obsession, actually. But before, I would like to understand better the first part that you said. So, about what was happening the day before.
Mm-hmm.
Could you explain better?
Yeah, the study was a daily study, and we followed these people for 14 days, I think, if I remember correctly. And we measured the same things every day. We measured maladaptive daydreaming, intensity and frequency, and we measured depression and anxiety levels, and obsessive compulsive levels, and social anxiety levels, and negative emotion, positive emotion. We measured all of these things, and we wanted to see the relationships within the individuals across days. So usually most studies are cross-sectional. That means that you measure everything in one time point, and you can see relationships by comparing people. So this person is more like higher in maladaptive daydreaming, so they would be higher in OCD. But in this study, we wanted to look at the same people across time and look at their relationships between days. So on days that you have like an increase in frequency and intensity of maladaptive daydreaming, would you be more obsessive and compulsive on that day, on that specific day?
All right. So all the people in this study had also compulsions.
Well, not all of them. There were 77 people in the study, so we had variance, and some people had compulsions, some people didn't have compulsions. But the interesting thing was to see variance within days and not just within people.
All right.
And other thing that I did, this is my specialty, I do this in a lot of studies, I like to study the temporal relations. So not only to see if on the day that you're daydreaming more, if on that day you'll be more obsessive, but also to see if you are more obsessive the day before, if you're more obsessive the day after. So to try to figure out like kind of a temporal relation across time. And of all the other variables, the OCD was the only one that was increased on the day before, the day before the days of increased maladaptive daydreaming.
All right, now it's clear.
There were a lot of things that were increased the day after, which are perhaps are more like a consequence. So the day after maladaptive daydreaming, people were more depressed and had more negative mood. A lot of things, but the day before it was pretty consistent that it was only OCD.
That's very, very interesting. So about obsessions, what do we know about being obsessive in relationships or be obsessed by someone? And how does it relate with maladaptive daydreaming? Because this is a quite a frequent topic on the online communities.
Okay. Well, that's very interesting. There's actually a group of researchers in the OCD field that have identified like a special subtype of OCD, which is OCD focused on relationships. And this is actually called relationship OCD, or in short, ROCD. R and then OCD. So this is really interesting. It's actually Israeli researchers, but it's a very well-known concept internationally. And it's basically people who have OCD and they meet all the criteria for OCD, but the content of their obsessions and compulsions are related to questions and doubts regarding relationships, like um, do I really love her? Right? Am I really, really in love? Is this really love what I'm feeling? Or it could be maybe I touched this woman accidentally and I actually want to cheat on my partner, right? Or something like that. There's various content possibilities, but that's like a subtype of OCD, and definitely I could see how these two could interact. The special OCD with maladaptive daydreaming, because obviously some people who have maladaptive daydreamings have fantasies about relationships and maybe sexual relationships, sexual encounters. So that could probably interact. I do not know of any study, though, yet that has studied specifically ROCD with maladaptive daydreaming. That could be a really interesting study to check out.
Yes. Yeah, so let's move on with the next question. So some people in my community reported to have excoriation disorder or trichotillomania. So is there a connection with maladaptive dreaming? Could they be a sort of alternative to those repetitive behaviors, like walking?
Yeah, yeah. Yeah, well, first of all, excoriation disorder, which is maybe if someone doesn't know, it means skin picking. So you pick on your skin compulsively, and trichotillomania, which is hair pulling. So these are two disorders that have, in the last years, in 2013, the last psychiatric manual, official psychiatric manual, the DSM, they've been inserted in the chapter on OCD. So they're considered OCD-related disorders. They have a few shared phenomenological characteristics, such as the compulsive urge to do something, and you only get a relief after you do this compulsion. And it's very, very related to maladaptive daydreaming. In fact, a study that I did with Eli Zomer and Dr. Colin Ross, we did a study on comorbidities of maladaptive daydreaming. And we found really, really, really high rates of skin picking disorders. So that was very surprising and interesting. And it was more than OCD, actually. It was really like, I don't remember, maybe 20 something percent of our sample, something really, really high compared to the prevalence in the population. So it's obviously very, very related. So the question is why and how, right? So that we need more research, but it seems to be probably, yes, related to the repetitive movements that maybe perhaps help people get into that special state of mind. That some people need this repetitive trigger to get into this special, unique, altered state of consciousness, right? To get into this very absorbed daydreaming. And it's interesting because it kind of raises question about the mind and body relationship. Do you need to maybe have like this stimulus in your body to get really into your mind? And maybe it helps you detach from your mind, or maybe it helps you stay in contact. Detach from your body, or maybe stay in contact with your body. So that's a question. I'm not sure. I think it needs much more research. And I actually have a student who's interested in that, who will do her dissertation, her doctoral dissertation on really the mind-body relationship and the relationships between being absorbed in your mind and what happens to your body. So maybe that's going to help us understand better in a few years what's happening there.
Yes, there are a lot of fields that needs to be researched deeply, I think.
Mhm.
Yes. So about ADHD, so something a little bit different. So I know that it can come together with maladaptive daydreaming. So why and when a person who has um, ADHD can have also maladaptive daydreaming?
Okay, so yeah, we did a study on that, and it actually it was a good question because, well, it started from the comorbidity study that I just talked about. We found crazy prevalences of these ADHD and ADHD without hyperactivity. It was almost 80% of the sample that had like comorbid ADHD, which is it's crazy. I mean, it's a lot. It's really a lot.
80%.
80%, yes, 80. That's a lot. So
Almost all of them.
almost all of the sample, they weren't necessarily diagnosed with this in advance, but we did, in our study, we did interviews, psychiatric interviews, and we noticed that they meet all the criteria. So almost all of the sample met criteria for ADHD, but most of them met the criteria for the ADHD without the H. That means that it's just the difficulty concentrating, but without the hyperactivity. So our thinking was that it's not really ADHD. So maybe it's a consequence of the maladaptive daydreaming disorder. And that led us to do another study, which is also under review. It's not published yet, where we interviewed, actually our student, Nitzan, interviewed a lot of people with ADHD. She looked specifically for a sample of people who had the diagnosis of ADHD. So first of all, we found a lot of maladaptive daydreaming in that sample, about 20%, but not 80%. So, which is what we expected. We expected that it'll be more than the percent in the population, because you're taking a sample of people with ADHD, so obviously they have kind of an attention problem, but really not 80%. So that kind of aligns with what we expected. So it's not the same thing. ADHD and maladaptive daydreaming are not the same thing. But then also we talked to them and we found out that, like we thought, they have those who have maladaptive daydreaming disorder, they say that their difficulty to concentrate is because of the daydreaming disorder. So they have this urge to daydream, and then they start daydreaming, so they can't concentrate in class. And this is actually what makes them meet the criteria for ADHD. But my thinking is that it's not a disorder they should be diagnosed with. They should not be diagnosed with ADHD. If maladaptive daydreaming disorder was in the DSM, was formal, and we had recognition for this, then the ADHD diagnosis would be unnecessary, because it's just the difficulty concentrating. It's just a consequence of the real problem, which is an addiction to daydreaming, right? So possibly ADHD is being overdiagnosed today, and a lot of people are saying that even without referring to maladaptive daydreaming. But maybe one of the reasons for the overdiagnosis is that you have, sometimes people have difficulties concentrating because of a host of different things. So it could be because they are addicted to daydreaming, and it could be because of post-traumatic disorder, and it could be because of depression, and it could be because of a lot of things. So it's kind of a question if maybe we really have to be more specific with the diagnosis of ADHD and find people that it's really not because of anything else, but because of like this inherent difficulty in concentrating. That's a good question. So I think there is a comorbidity, but it's not because of real comorbidity, but overdiagnosis of ADHD.
So you don't think it can be the opposite? So having ADHD can cause maladaptive daydreaming? Because someone asked, and that was my next question, if the connection could be because of addiction, because it looks like that who has ADHD tend to be more likely to develop a substance addiction.
That's an interesting question. I think that in most cases, the causality is from the daydreaming to the ADHD, um, because most people with maladaptive daydreaming have an ability, really like a mental capacity that most people do not have. I do not have this capacity. Eli Zomer also does not have this capacity. We cannot daydream so vividly like a lot of the maladaptive daydreamers can. So it seems to be that there's something very innate, very basic that they report that they are born with. Many people, not everyone maybe, but most that we talk to, they report that from childhood they could really get into this world of fantasy and enjoy it so much. And it seems to be something so much more basic. Now, in ADHD, the problems usually start a bit later. I mean, part of the diagnosis of ADHD is that it was there before the age of 12, because it is defined as a neurodevelopmental disorder, which means that it's developmental. It's across childhood. You can't diagnose ADHD if the symptoms started at age 20. But still, the symptoms require some external demand. You need to have an external demand, like in school, that you have to focus, and then suddenly you have a problem because you can't focus. So until age 6, most people don't have a problem with ADHD. It starts when they have to start school. So, and it's interesting because maladaptive daydreaming, a lot of people say, yeah, like from age 3, 4, I remember myself doing this, and it's like an ability that it starts even before the external demands. um, I'll also say that ADHD is kind of different because in ADHD, you're supposed to be very, very distractible. There's high distractibility. So you're supposed to be this person who hears a sound here and immediately goes and listens to that. And then there's something here and you go and listen to that, and you're like all over the place, right? And you can't focus on this one thing. That's theoretically the ADHD. And in maladaptive daydreaming, it's more similar to dissociative absorption, which I talked about earlier, that you're very much absorbed in something and you're very, very focused in your daydreaming, and you're so focused that you don't notice anything going on around you. So it's kind of different. It's not
It's
exactly
kind
the
of
same.
almost the opposite.
Exactly. So some things are opposite, some things are similar. Eventually, they could look very similar because eventually you have external demands like please focus at work or focus in your studies or whatever, and you can't do that, and you find yourself struggling and impaired in your functioning. So that's the similarity. But I really, like I said before, I really think there are different reasons why people can't focus, and we really have to notice and single out exactly what the reason is. It's very different mechanisms, I think. And relating the question regarding addiction, well, I think some people have problems coping, and then they use substances to help them sometimes escape their problems, and sometimes escape their feelings. And that can happen across a range of psychological, psychiatric disorders and problems. We know, for example, that women have more tendency to be depressed. They're higher in depression rates, and on the other hand, men are higher in alcoholism rates. So there is one theory that says, okay, women tend to express their emotions, so they express it by being depressed, and men, maybe they're not used to, the society tells them they can't express emotions, they have to be a man, right? So they turn to alcoholism. So there are different ways in coping, and I don't know if there's any relationship specifically between alcoholism and maladaptive daydreaming. I'm not sure. But definitely I would expect there to be some kind of relationship, because our studies show that people with maladaptive daydreaming overall have a high levels of psychopathology all across the board: depression, anxiety, OCD, skin picking, social anxiety, um, a host of different things that are just, they show that people with maladaptive daydreaming are suffering very much. So what started it? Was it the maladaptive daydreaming that caused everything else to go wrong? Maybe. We don't know. Probably different for every person, but they're definitely higher. They have more higher psychopathology than control samples, just normal people. So definitely, I would expect there to be some alcoholism or some tendencies for substance abuse among some people with maladaptive daydreaming, probably. Also, it's a behavioral addiction. So obviously, there is a tendency for becoming addicted. Yes, but this should be researched more. We don't know enough about it yet.
All right, but we have some more information instead about dissociation. You were talking before about dissociation. And so repetitive movements in maladaptive daydreaming create a sort of self-hypnosis. So is that necessary to dissociation? And could you also explain better these two concepts, dissociation and self-hypnosis, and how are they connected with maladaptive daydreaming?
Okay, that's a big question.
Okay.
I'll start. I hope I don't forget anything. So yeah, dissociation is kind of hard to define because it's like a big term. It relates to different things, to a host of different things, and some people who use it mean some things, whereas others mean other things. But one of the concepts strongly related to dissociation is really dissociative absorption that I talked about before, and it's a construct that really talks about the tendency to be absorbed in daydreaming so much that you lose touch with whatever is around you. And this tendency is also related to acting on autopilot. So you might be like daydreaming, and at the same time, you might be like doing the dishes or doing something automatically. And then later, maybe you won't know, wait a minute, did I do this dish? Did I insert the dishes into the dishwasher, or did I take them out? What did I do? And then you find like something maybe in the cupboard that is not clean. Maybe it has dirt on it, and you put it in the cupboard because you acted on autopilot. You acted automatically, right? So this is a dissociative state, but a mild dissociative state, a normal dissociative state, not very severe, something that could happen to anyone. But there are individual differences in the tendency to act automatically. And this tendency of dissociative absorption and automation is also very strongly related to suggestibility. Suggestibility is the degree to which you are influenced easily. And this is actually also very much related to hypnotizability, the degree to which you can get yourself into a hypnotic state, or someone else can get you into a hypnotic state. These things are all related. They are different concepts, but with strong relationships, and historically have been viewed also as very much related. So it is very, very interesting to see the repetitive movements as kind of a self-hypnosis. I think this is very, very interesting, and it relates to the mind-body connection. As I said before, I have a student very interested in that, and how you can use maybe your body to affect your mind and to get into some kind of an altered consciousness state. I think that some people can get into it without needing this kind of self-hypnosis, repetitive movement. So this is something common in maladaptive daydreaming, but there are people who are high in dissociation and high in dissociative absorption that can get into it like that, and they don't need the repetitive movement. So it is a question why in maladaptive daydreaming people need this repetitive movement for the self-hypnosis, because people who have dissociative disorders are very high in dissociation. They don't necessarily need it. They just get into the state spontaneously. So yeah, I don't know. It's very interesting. I think that maladaptive daydreaming has a very strong motor element that we still don't understand fully, and this needs more research,
Yes.
like
So
everything I'm
uh,
talking about.
yes, of course. So you think that uh, the hypnosis is a sort of way to get dissociated? Is it what you were saying? Okay.
Yeah, dissociation is kind of, it could be viewed as some kind of a state which is very similar to hypnosis. Historically, these concepts were very, very much related in the history of psychology about 150 years ago, 120 years ago, let's say. So there were patients who were diagnosed with hysteria back then. There was a diagnosis called hysteria in the days of Freud and other people, other scholars of that time. And these patients with hysteria, they had high dissociation levels, very, very high dissociation levels. And they had this tendency for narrowed attention, like dissociative absorption. And their symptoms were a lot of the symptoms were something that today we call conversion disorder, which is like neurological symptoms, like they were suddenly blind, or they suddenly could not move their hand or the leg, or they had these seizures, various symptoms that today we would diagnose as conversion disorder. And it is very well known that conversion disorder today it is viewed as kind of like a self-hypnosis, because you have certain ideas, like certain ideas about your hand, like I'm not functional. Okay, that's like a metaphoric idea. I can't function, and then suddenly my hand goes limp and I can't move it. So that's kind of like the abstract idea, the metaphorical idea caused me to have a neurological symptoms. That's a very strong mind-body relationship, and that was very common then. Today it's less common. It exists, but not as much. Um, so definitely people that are high in dissociation, they have more of a tendency for this type of ability to convince themselves of things, and whether they like it or not, right? Not necessarily intentionally, but they do have high tendencies for this. And conversion and dissociation are very, very related. So I don't know if conversion and maladaptive daydreaming are related. That's an interesting question to think about and maybe research, but definitely the concept of self-hypnosis is very much related to dissociation. Yeah, but this thing with the repetitive movements, it's not, it didn't exist in the field of dissociation until now. This is new, and this also links to other fields, the field of autism and children who have repetitive. There are diagnoses that are about this, that are about stereotypical repetitive movements in children. Maybe they all have maladaptive daydreaming and they're just too young to tell us that they're daydreaming. I don't know. But these are other fields. So this kind of brings a new element to the field of dissociation research. Dissociation in itself was not until now related so much to repetitive movements. So it is very interesting. I think that's one of the
Yes.
most interesting fields in maladaptive daydreaming that we should really understand better. This
Yes. Also, I'm very curious about this, about the children moving and maladaptive dreaming. Maybe it's an early
yeah.
way to find out. Yes. So let's move deeply on the subject of the body and mind connection. Maladaptive dreamers report to forget to eat or also to stay awake at night because of daydreaming. So, how frequent is the loss of sleep? And what are the consequences?
The loss of sleep.
Yes.
Well, first of all, I have to say this question is really interesting to me, because my student who is interested in the mind-body relationship, she and I devised a questionnaire that asks exactly about this. Do you forget to eat? Do you forget that do you suddenly realize that you have to go to the bathroom and really hard and you didn't notice it? And all of these questions asking about something that conveys kind of a disconnection with your body and with your bodily needs. And we didn't start out from thinking about maladaptive daydreaming, but just about absorption. We were thinking about dissociative absorption and about this disconnection between the mind and the body. So we really devised this questionnaire, and we just ran it on a lot of people, and we still have to look at the data. We haven't looked at the data yet. So it's going to be really interesting to see its relationship with dissociation and maladaptive daydreaming, and we measured all of those things. So that's going to be really interesting. So that's just as a side note. Regarding sleep, I'm not sure if people don't sleep, because I'm sure some people don't sleep because of their urge to daydream, but as a whole, I don't know if there's a lot of sleep deprivation in this population, because well, I did one study with Ellie that I in the daily diary study, which I mentioned before. I didn't yet have time to work on the data of the sleep. We also measured sleep, but we didn't publish it because it's because of my lack of time. Unfortunately, I'll do it one day. But we did have data, and I did look at the data back then. So I measured two things. I measured sleep quality and sleep quantity. So sleep quality is how much time does it take you to fall asleep, and do you wake up at night or have difficulty going back to sleep, or maybe wake up early and then can't go back to sleep. That's sleep quality. And also, do you sleep well? Do you wake up feeling rested? That all that is sleep quality. Also, sleep quantity. How much do you sleep? And also, I measured another thing. As I said, I'm a dream researcher originally. I started out as a dream researcher, and I'm very interested in unusual dreaming. I researched a lot a construct called sleep experiences, or sleep-related experiences, which are kind of like a host of unusual dreams that tend to be experienced by the same people. So it's like falling dreams and flying dreams and nightmares and recurring dreams and dreaming of waking up within the dream, a host of different things. And the researcher who devised the questionnaire found that it's one factor. It's like if you're high on this, you're probably going to be high on this. So kind of like people who remember a lot of dreams tend to report all of these types of dreams. And I researched this construct, and I found out way before I met Ellie that I found out that it's very much related to stress and distress, anxiety, depression symptoms, and also transient stress. So I found that out also among people, but also between days, within days, like I said before. So when you're more stressed, you have more of these dreams. So anyway, back to the maladaptive daydreaming daily study. We also measured sleep quality, sleep quantity, and sleep-related experiences, but I measured them with a daily measure. So I wanted to see if on days that you have more maladaptive daydreaming frequency and intensity, do you have at night, do you have these dreams? And interestingly, my finding was that sleep quantity and sleep quality had no effects. They were not related, again, within days and nights, they were not related to increased maladaptive daydreaming. But these unusual dreams were. So on days that had more intense and frequent maladaptive daydreaming, there were also in the night more dreams, more unusual dreams. So that's the relationship that I found, and I did not find a relationship with sleep quality and quantity.
On the days that people were daydreaming, in the night they had also night dreams that are
Exactly.
of the kind of that specific kind. So the
This unusual, exactly, this unusual kind. And I think that it relates to the fact that dreaming, night dreaming, and waking imagination, these two systems are very much interrelated. And there are a lot of shared mechanisms between our waking imagination and our night dreaming. So like if you have a tendency for more vivid imagination or more bizarre imagination, or something that's more creative maybe, then your dreaming will also be more of those things. So dreaming and imagination are very, very intertwined. So I think that's a very interesting finding, that maybe in maladaptive daydreaming there are more unusual dreams and more creative dreams and bizarre dreams. And I really have to look into that more and publish those findings one day.
Yes, please do. And So actually, one of the question was, is there a connection between daydreams and night dreams? So, for example, could a person who spent most of the day in a fantasy world dream about that world? Do we know
Yeah,
it?
so definitely, I think there's a strong relationship, and one of the methods that therapists use to help people overcome nightmares is actually having them think about it during the day, because these two systems are so related. So it's called imagery rehearsal therapy, or IRT in short. So if you have chronic nightmares, the therapist could give you like tasks to think about it during the day and to invent a better ending, to invent a positive ending, which very much uses your imagination for benefit. And this thing where you use it during the day and you imagine this ending and you rehearse it during the day and you think about it a lot, it increases the chance that you also will dream about it at night. So if you have this nightmare again, suddenly during the night you might have this positive ending because you rehearsed it during the day. So definitely, I think that would be very unsurprising if someone had this fantasy all during the day and then he dreamt about it. That would not surprise me at all.
That's very fascinating, this interconnection.
Yeah.
So, um, I have just one last question for you. So,
Okay.
because this interview was very technical, so many psychologists and professionals may find it useful. So, what do you suggest to them when they face a person who suffers from maladaptive daydreaming?
You're asking me what I suggest to the therapist?
Yes, to a therapist.
Okay. Well, that's a good question. I'm a clinical psychologist myself. I'm not sure that I know how to cure someone of maladaptive daydreaming.
But maybe also how to face, because
Yeah.
people also they feel in discomfort when they have to talk about it. So maybe if the professional on the other side, the therapist, knows what they are talking about, maybe they know also how to behave, what to say.
Yeah. Yeah, well, first of all, I think if you have a client who has this condition, read about it. I mean, read all the papers. There aren't so many papers, like 20 something papers. It's not a lot. Read at least the abstracts and understand a bit more this patient's experience, and listen closely to what this patient has to tell you, because I think a lot of people don't understand that this is something different. And when I tell colleagues about maladaptive daydreaming, I tell them this, I researched this thing and it's called maladaptive daydreaming and it's really interesting. And they say, oh, but why are you pathologizing daydreaming? Daydreaming is normal, everybody does it. And you're just inventing a new disorder, right? And you have to convince them that it's true and it's real. It's very hard for colleagues to believe that, because it's unbelievable that we as a field have missed this. I mean, psychology has existed for at least like 130 years, and we have missed this all this time. How can that be? It's inconceivable. So people have a really hard time accepting this, and I always say that Elie Zommel should win a Nobel Prize if there was a Nobel Prize for
Yes, that's
psychology.
true. I agree.
But I know it and you know it, but most of the world doesn't know it yet. So yeah, it's really difficult for people to understand. So I think first of all, listen to your client and understand their experience closely, and read about other people with maladaptive daydreaming and their experiences. So that could be reading papers, academic papers, and that could also be looking online and reading people's experiences and understanding really that this is something else. And most of us do not, like I said before, we do not have this capacity, and then therefore we do not have this risk, this craving is really difficult to battle. It's very addictive, and to have empathy, sympathy for your client, you need to really understand that this is something which is very hard to battle. So that's the first thing, really, to understand and to empathize. And and to realize the great difficulty and not say, oh yeah, daydreaming is just a symptom of something else, and don't need to pay too much attention to it. It's just daydreaming. So first of all, really to understand. And also I think really I think we need to draw on different fields to help people with maladaptive daydreaming. So it's a bit like an addiction, and it's a bit like OCD, and it's a bit, for some people, it's a bit post-traumatic. And for some people, it's very similar to rumination. And it's a bit OCD-ish. No, I said OCD, I meant ADHD. And, there's a lot of social anxiety also. So really trying to integrate all of that into some kind of an integrative therapeutic approach would probably be the right way, but really depending on what the client brings and how it started with them, and how does it answer their need, or I don't know what it helps them with, and maybe how they can develop a better way to cope with those things. That's probably
The best thing
what
to
I
do.
would say.
Okay,
Yeah.
very, very clear. Thank you. So that was my last question. And yes, nothing else. I really want to thank you for your time, for your work. That was really interesting. And I have now a clearer picture of maladaptive daydreaming, but also I have a lot more questions in my mind because yes, we need more research, and I hope you will have the chance to do it, you and your colleagues, of course.
I promise that I'll try.
Yes, thank you very much. I hope to have you again with us soon.
Okay, thank you very much and good luck.
Thank you.
Bye bye.